Okay guys, so today we will now be discussing emergency scene management. Okay, what is ESM or what is emergency scene management? So this is the sequence of action you should follow at the scene of an emergency to ensure that safe and appropriate first aid is given. So, sequence of action, step by step. So, dili ta pwede magpataka when it comes to rescuing victims no? In an emergency situation. That's why important kayo nga focus because there is a sequence of action, a step-by-step procedure that we need to follow no, when it comes to helping a victim during an emergency situation to make sure that we are able to actually provide safe no nga safe help, safety sa atong victim, and also safety sa atoang self as the rescuer. Now, what is the main priority when we talk about emergency scene management? So the order of the steps in ESM, including the priorities of first aid, may change depending on the circumstances. Again, it may change depending on the circumstances or depending on how life-threatening is the situation of the victim. Okay, so these are now the 4 steps of ESM. So this is usually done in order. Dili pwede that you will be skipping one step and then you'll move on to the next. No, this should be done step by step. Okay, so first is the scene survey, followed by the primary casualty survey, and then the secondary survey, and the ongoing casualty care. So when we talk of scene survey, so we are actually following the mnemonics setup. S-E-T-U-P. So, unsa man yung meaning sa setup? S for stop. Okay, you stop. You check the environment. Is the environment safe? Is the scene safe? Okay, that's when you survey the scene. You check for hazards. Okay, you check for the traffic. You check for unknown hazards. And you check for personal barriers. Okay, so we'll just have to follow the mnemonics setup. S-E-T-U-P. S for stop. Look around. E for the environment. Make sure that the environment is safe. You check for the traffic. Basig si victim naa siya duol sa highway. Okay, or you check for unknown hazards. Basi na falling debris. Okay, or there are mga electrical wirings, mga live wirings, which is very dangerous, or personal barriers. What are these barriers nga kuan sa imuhang pag-approach safely sa victim? Okay, so these are now for the scene surveys. During the scene survey, you need to take charge of the scene. You take charge of the scene, kay dapat ikaw imuha na gi-check tanan gyud nga area wa kay dapat skip. Call out for help immediately. You assess the hazards, thus making the area safe. If the area is not safe and if it's possible for you to move the victim from that unsafe area to a much safer area, then you need to do so. Now, find out the history, the number of casualties, the mechanism of the injury. Unsa kay possible nga nahitabo? Isa ra ka victim ang imong nakita. Could it be that there are more victims around? Okay, and then you identify yourself as a first aider and you offer help. It's very important that you need to identify yourself. Okay, para if ever there are bystanders or there are relatives of victim or even the victim himself, no, will know kinsa ka and what you are about to do. Okay, so that way they will know that you are there to help. You are not there to cause further injury. Next is you assess responsiveness. Okay, so how do you check for responsiveness? That is when by tapping the shoulder. Hey, 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 are you okay? Hello, ma'am. Hello, ma'am. Baby, hey, hey, are you okay? Okay, now next after checking the responsiveness, make sure that you have your PPEs ready. Unsa man mga PPEs nato? You have your gloves, you have your mask. Okay, you can also use whatever it is that may protect the eyes, any PPE. So because when we talk of personal protective equipments, these are actually equipment that will help protect ourselves from getting what microorganisms. Pwede nga kita para kita di ta makatakod sa ato ang victim, or ang victim mismo dili makatakod sa ako. That will keep us safe from getting those infectious na mga diseases. Okay? So, usually in an emergency situation, unsa may first gid nga ato ang ma-secure, pero it's the gloves and the mask. Diba? So, you also need to check what happened. What really happened? If there's someone there, a bystander, you can talk to the bystander. What happened? Actually, kay basig bag-ura ka naabot, and then taud-taud na din naa sila diha ang mga victim. Now, warn not to move. As much as possible, if the victim is responsive, victim is able to answer your questions, make sure that you warn them not to move their body, because this might cause further injury, especially if there is already injury to the spine, okay, to the neck area and to the whole back. And then you get consent. Okay, so you get consent from the victim, you get consent from the bystanders, you get consent from the relatives. Whoever it is that is there witnessing the accident, then you need to get consent. Okay, now later I will be talking about during the introduction, during our discussions, introduction to first aid, I think I was able to discuss the different types of consent. Okay, so if unresponsive or serious injury, serious na gyud, tanaw nimo murag grabe na liki na ulo, wala, unresponsive na, nga balik-balik na dito, grabe na ang bleeding, then get medical help immediately. Basin pa madala pa og rescue. Okay, now next, so how do we do the primary casualty survey? Okay, so ganina is the scene survey. Okay, next is the primary casualty survey. So picks up where the scene survey left off. So this immediately follows scene survey, the primary casualty survey. So picks up where scene survey left off. In the primary survey, you check for the priorities of first aid, the ABCDs. Okay, what are these ABCDs? Check for the airway. If the airway is obstructed, then you make sure to open the airway. Check for the breathing. So breathing must be checked 10 seconds lang. Okay, LLF, look, listen, and feel. Now you check for circulation. How will you know? How will you check for circulation? Okay, so just by pressing on the nail beds, you will know nga okay ang circulation niya. You check the lips, dili ba pale? Okay, you check the palms of the hands. So check for circulation, and of course you check for the pulse. Now, check for any deadly bleeding present, and make sure to stop that bleeding. Okay, so what do you use to stop the bleeding? Okay, gamit na ta atong mga bandages. Okay, or anything that you see, any cloth material that you can use to put pressure over that area that is wounded and has severe bleeding, then you use that. You need to control the bleeding, because if too much blood is lost from the victim, then that could already cause shock. Okay, cause natag shock sa victim. Okay, so primary casualty survey, what you need to remember are your ABCDs. A for airway, B for breathing, C for circulation, and of course D for deadly bleeding.